Alright, this is the first in a series of 3 recordings for posterior abdomen, and in this presentation I'm going to be focusing on the first objective, which is talking about the muscles of the posterior abdominal wall. So in the posterior wall there are 3 main muscles. They are listed in the figures here. We have on the left the psoas major and psoas minor muscles. The minor is smaller and it sits on top of the psoas major muscle. You can see it here. It has a slightly longer tendon. We also have the iliacus muscle, which is sitting in the iliac fossa of the pelvis. And then we have the quadratus lumborum muscle, which is sitting between the 12th ribs and the iliac crest. So I have the table here outlining the key things that you'll need to know about each of these 3 muscles. And really, please just focus on the specifics that are highlighted in the red. So you don't need to know the real specific details. So for example, the quadratus lumborum, its inferior attachment is the iliac crest. I don't need you to know about the iliolumbar ligament and things like that. So just what I've highlighted. Alright, a couple things to highlight. The psoas muscle, if you look where the red circle is on the left, the psoas and the iliacus muscles leave the abdomen under the inguinal ligament, and they have a common insertion onto the lesser trochanter of the femur. Therefore, at that location where the red circle is, they're often referred to as the iliopsoas muscle. So it's just a combination of the two. Okay? But that actually arises from these 2 distinct muscle groups, the psoas and the iliacus muscle. Also recall that all muscles, and this is more related to the figure on the right, that all muscles are surrounded by a thin connective tissue fascia. We talked about that with the intercostal muscles, the muscles of the abdominal wall, everything. And in the case of the psoas muscle, which you can see in the figure, that psoas fascia that surrounds the psoas muscle actually has some clinical significance. So just be aware of that concept, particularly as it relates to the worksheets that we'll be doing. Alright, so these muscles, there is a number of different structures within the posterior abdominal wall that have close relationships to these muscles. And so those are all listed here. You have the table, but I'm going to use the images that follow to highlight some of these things. So starting with the psoas muscle, you can see on the figure on the left, I've elegantly, outlined the psoas muscle in orange lines. So that's where the psoas muscle would be, and it would be the same on what would be the left side of this cadaver. And so some of the important relationships, first going to the right side, to the right figure, the lumbar plexus. And we're going to talk about this in another lecture, but the lumbar plexus is all the nerves that are coming off the lumbar vertebrae and passing on to different structures. But all those nerves are going to pass through the psoas muscles and go off to their final destination. So the lumbar plexus is a really important relationship to the psoas muscle. Anterior to the psoas muscle, we have the ureter. And on the figure on the left, you can see the black arrows are pointing out the ureter as it descends in the posterior abdomen down toward the bladder. It runs along or over top of the psoas muscle. The appendix is also laying over top of the psoas muscle, so the circle on the right side highlights the appendix sitting over top of the psoas. As well, if you go back to the figure on the right, the genitofemoral nerve is running along the top of the psoas muscle, right along the length of it. Looking medial to the psoas muscle, highlighted by the blue arrows, the common iliac and the external iliac arteries are running alongside the psoas muscle in the medial aspect. So that's a little bit about the psoas muscle. For the iliacus muscle, highlighted by the red circle, is the cecum. If we go to the right side image, the lateral cutaneous nerve of the thigh is actually running in the iliac fossa, right over top of the iliacus muscle. And then finally, the ilioinguinal nerve, which is highlighted by the black line that's descending down from above runs along the superior margin of the iliacus muscle as it goes on toward the inguinal canal. So that's a little bit about the iliacus. And then finally the quadratus lumborum, important relationship. It's in the posterior wall, and the kidneys, both sides, are sitting right over top of the quadratus lumborum muscle. And then there are three nerves, the subcostal nerve, iliohypogastric, and the ilioinguinal nerves are all running across the quadratus lumborum as they head toward their final destination. So, by way of summary, we focused on the key muscles of the posterior wall and some of the key features and some of the relationships of those muscles to other structures.